Hello, everyone. Welcome to Generations Forum. My name is Peter Kaldis. I am the CEO of the American Society on Aging, and I want to welcome everyone to our final day of our forum. It is called From Ageism to Age Inclusion. And if you haven't been part of this week's events, I have to say you're missing out. But thankfully, we have all the videos on demand in our conference platform. So we hope you visit that and check out all the wonderful resources as well as the prior day's events. You know, we had advocates, we had really candid conversations, we had practical conversations around ageism. And we also made some special announcements this week, including a brand new partnership with Shutterstock. The ASA and Shutterstock are working together to really change how we see aging by creating a new grant opportunity for artists and photojournalists and other creatives. And we also released our first ever legislative tracker. As some of you may be aware, the ASA has focused on 4 key priority policy areas, one of which is combating ageism. And as an ASA member, you get a benefit of having access to that legislative tracker, and all that information is available in our communities. And now for our final day. We're going global on this Friday, and we're really grateful to our sponsors, AARP and George Georgian, for helping us really continue our learning today from our friends outside the United States, but also within the United States at the United Nations. So without further ado, I want to introduce Peter Rundlet from AARP. Peter, happy Friday.
Thank you, Peter. It's a real pleasure to be here. I'm really thrilled to be having this conversation today. As some of you may know, today is December 10th, which is also the 73rd anniversary of the signing of the UN Declaration for Human Rights. And so the UN has designated every December 10th as Human Rights Day. So it's a perfect day to be having this conversation as we start to think about ageism, age discrimination, and the human rights of older persons. So it really is a global conversation, as we'll hear throughout this conversation today. AARP, like the ASA, is primarily a domestic organization, but the international team is very much engaged with the UN, with other international stakeholders, because we have this sense that, you know, good ideas don't end at the border, and some countries' populations are aging more quickly than ours in the United States, and we have a lot to learn from partnerships and others, policymakers, think tanks, and organizations all over the world who are doing really good work on behalf of older persons. And so the function of my team is really to do some of that engagement. And we are also very much engaged in the battle against ageism and age discrimination. So we are really pleased to be here today. And it's a real privilege because we have three of the giants of the topic that we're talking that we're talking with today, who've been working deeply and for a long time on combating age discrimination, looking at ageism, and thinking of ways that we can do better to overcome that. So I'm really excited to introduce you to the 3 speakers we have today, and I'll describe them now. First, we have Dr. Vania de la Fuente Nunez, who is Technical Officer of the Demographic Change and Healthy Aging Unit at the World Health Organization. Dr. La Fuente Nunez manages the global campaign to combat ageism at the World Health Organization. And she's one of the 2 lead authors of the first UN Global Report on Ageism, as you hear. Vania also drives capacity building efforts on aging in countries and regions around the world. Next, before we ask Vania to open up for us, we have Cynthia Stewin, who is the main representative to the United Nations on behalf of the International Federation on Aging. She is currently the chair of the NGO Committee on Aging at the UN, and perhaps most importantly, a past chair of the ASA Board of Directors. Cynthia's entire professional career has been devoted to improving the lives of older persons on local, national, and international levels. And we're super excited to have her with us today as well. Finally, we have Justin Derbyshire, who is the Chief Executive Officer of Help Age International. If you don't know about Help Age International, I really urge you to do a little research and learn what some of the work they're doing around the world. It's really phenomenal work. Justin has overseen emergency responses in Nepal and Ukraine, driven the regional and country strategic reviews, and led the implementation of Help Age International's change process, which was marked by a shift from a traditional NGO delivery model to be a global secretariat working with and through its network of 138 members around the world. And so we'll be excited to hear from Justin as well. But to start the conversation this morning, I want to ask Dr. De La Fuente Nunez to begin the conversation because she has been so deeply involved with this issue at the global level. Anya?
Thank you so much, Peter. Like you, I must say that I'm also very happy to be here on such a special day on Human Rights Day and to give due attention to ageism. So thank you very much for inviting me to be part of the Generations Forum. And thank you, Peter, for the kind introduction. I'm going to try and share my screen, which hopefully you will all be able to see. So just give me 1 second whilst I do that. Up. If you could just flag or nod if you can see it, that would be very helpful, as I can only see some of you. All right, brilliant. So today, what I wanted to talk to you about, given the focus of the discussion today and its global focus, is first the UN Decade of Healthy Aging. And then as part of the UN Decade of Healthy Aging, I will be talking about the global campaign to combat ageism that is led by the World Health Organization in cooperation with other partners. And let me start by just saying that a longer life is an incredibly valuable resource. It provides the opportunity to rethink not just what older age might be, but how our whole lives might unfold. But the extent of the opportunities that arise from this increasing longevity will depend heavily on one key factor, which is our health. If people are experiencing those extra years of life in good health, their ability to do and be the things that they value will be little different from that of a younger person. But if these added years are dominated by declines in our physical and mental capacity, the implications for us as we age and for society are much worse. It is often assumed that increasing longevity is being accompanied by an extended period of good health. Yet there is little evidence to suggest that this is the case, and there are great variations that we see within and across countries. Just to give you an idea, we know that, for example, in 2019, 60-year-old females in Mexico could expect to live 16.8 years in good health. In the United States, an average of 17.1 years, whereas those in Spain could expect to live up to 20.3 more years. We also see an increasing gap between life expectancy and healthy life expectancy across countries, which means that whilst we may be living longer, we're not living those additional years in good health necessarily. Despite the predictability of population aging, both its accelerating pace and the gaps in health longevity that I just described, the world is far from being prepared. And I think COVID-19 has shed light on the many gaps that still exist, not just in the things we do, but also in how we think about aging and older people. The differences we see within and across countries show that change is possible and that we can aim for healthier, longer lives. These gaps only signal the many opportunities that exist to add life to years. Together, we can make that happen. So I wanted to start the presentation today by talking to you about this new global initiative, the UN Decade of Healthy Aging, which goes from 2021, so from this year, up until 2030, and which aims to leverage on the many opportunities that exist to add life to years and ensure that healthy aging is a reality across the world. This is a plan for 10 years of concerted action that is going to improve the lives of older people, their families, and their communities. The Decade of Healthy Aging is about every single one of us. We all have the opportunity to play our part. And I can say that there is not only very strong support for the Decade of Healthy Aging and its work in the UN system, but also within civil society, academia, and the private sector. The decade is intended as a global collaboration that will bring together diverse sectors and stakeholders, including governments, civil society, international organizations, professionals, academic or research institutions, the media, and the private sectors, to improve the prospects of current and future generations of older people. Again, we cannot make this happen unless we're all part of it. And of course, engagement with older people is central to the work of the entire decade. I wanted to briefly talk to you about the 4 opportunities for action that are part of this decade and part of the plan of action for the decade of healthy aging, so that you get an idea of what we hope to achieve in the next 10 years with your support as well. Our first opportunity is to build communities that allow us to age in the right place, to continue to develop personally, be included, and contribute. Age-friendly cities and communities are created by removing physical and social barriers and by implementing policies, systems, services, and also technologies that allow people to continue to be and do what they value. We already have very good examples of the work that is being done in different countries, including in the United States, as well as other parts of the world, but we hope to see many more examples develop in the coming years. We can also make sure we offer integrated and people-centered care and primary health services that respond to the needs of older people. Today's health systems are often better designed to address individual acute health conditions than the more complex and chronic health needs that tend to arise as we age. Therefore, it is essential to develop and implement comprehensive and coordinated primary health care that can better respond to the need of older people. And the implementation of these integrated people-centered care is crucial, as it can improve access to care at the community level, and can improve coordination of services and providers, and thus reinforce the intrinsic capacity of older people. Third, we have the chance to improve and strengthen long-term care for older people who need it, which we have seen to fail dramatically in the context of the pandemic. Any effort to address the health and social needs of older people must ensure that no one is left behind. This means paying attention to older adults who experience significant declines of capacity and therefore need the support of others to continue to do what they value. Access to good quality long-term care is essential for people with a significant loss of intrinsic capacity, as it can enable them to enjoy basic human rights and live in dignity. All countries need to have a long-term care system. And unfortunately, many countries still don't have any long-term care services. And those countries that do have long-term care services do not necessarily have adequate coordination or adequate training, or do not offer the possibilities that older people actually want. And finally, in the coming years, we have the chance to change how we all think, feel, and act towards age and aging. This requires putting an end to ageism, or what is the same, putting an end to those stereotypes, prejudice, and discrimination that arises on the basis of our age, and that is directed both towards other people, but also towards ourselves, again, on the basis of age. Despite the many contributions of older people to society and their wide diversity, negative attitudes about older people are common across societies and are rarely questioned. These age biases create barriers that are often insurmountable and cause very negative effects on our health and our well-being. The plan of action for the decade of healthy aging not only includes combating ageism as one of the 4 action areas for the next 10 years, but it also highlights combating ageism as a prerequisite for advancing the 3 other action areas. Member states are paying attention and are very aware of the need to address this insidious issue. I will be focusing specifically on the work that the WHO does in this area for the rest of the presentation. And all of the work that we do in this area falls under the Global Campaign to Combat Ageism, which envisions a world for all ages and aims to get there by changing the way we all think, feel, and act towards age and aging. And this mission makes sense given that ageism refers to how we think, stereotypes, how we feel, prejudice, and how we act, discrimination, towards others or ourselves based on age. The Global Campaign to Combat Ageism focuses on 4 key areas of action that you see reflected on this slide. First, generating data and evidence to create a path forward. This allows us to better understand what ageism is, why it matters, and how we can address it, and how we can measure change. The global report on ageism that we launched earlier this year is the culmination of over 4 years of hard work compiling the best available evidence on the topic and conducting research where there were gaps, and then distilling key recommendations for action. Also, under this area of work, we are developing a valid scale to be able to measure ageism against all age groups and across countries. Second, we work on building a global coalition to coordinate efforts to prevent and respond to ageism and enable sharing of knowledge. Third, raising awareness and building capacity to inform, to advocate, and to change the narrative around age and aging. And to also ensure that evidence-based practice is implemented across the globe to help create a world for all ages. And last but not least, we have a platform for global action to bring change makers together to align efforts and to optimize local, national, and global responses. Work is already happening out there. We want to know what's happening, and we want others to be able to draw from existing experience. This is the Ageism Hub that is available on the platform for the Decade of Healthy Aging, and we will be providing a link to that at the end of the presentation. But now, drawing from the findings of the first global report on ageism, I will explain why ageism is a problem of a global scale and what we can do about it. And there are 3 main reasons why we should all worry about it. First, it affects us all. Second, it is everywhere. And third, it is harmful. But let me start with the first one. Ageism affects us from early childhood onwards. This means that ageism can be directed towards younger and older adults, even if the manifestations may be different depending on the life stage that we're at. This actually means that ageism affects all of us. We also know that ageism is everywhere. It exists in our institutions, our relationships, and ourselves. Institutional ageism refers to the laws, the policies, the social norms, and the practices of institutions that unfairly restrict our opportunities or that systematically disadvantage us on the basis of age. It is seen across many institutional settings, including employment, healthcare, the legal system, housing, and many more. Just to give you an example, in healthcare, age determines who is treated with certain interventions or medical treatments in a large number of cases. We also saw this very clearly in the context of the COVID-19 pandemic, where older people were denied access to health services and resources, such as access to intensive care units, only on the basis of their chronological age. Interpersonal ageism refers to ageism occurring during interactions between 2 or more individuals. For example, when people patronize older or younger adults, or ignore their views, or use an infantilizing way of speaking when interacting with older people. And self-directed ageism is the ageism that we turned against ourselves. We basically internalize the age-based stereotypes that we have been exposed to throughout our life and eventually apply them to ourselves, which can then limit what we do or don't do. And in terms of numbers, globally, we see that 1 in 2 people are ageist against older people. This is half of the world's population. And in Europe, and this is the only region where we have evidence available on the prevalence of ageism against all age groups, we see that younger people report more ageism than other age groups. Ageism is also harmful. It has a very negative impact on our health and well-being when we're older. It is associated with an earlier death and poor physical and mental health, including the presence of chronic conditions, hospitalizations, and depression. Based on figures for 2015, globally, about 6.3 million cases of depression are estimated to be attributable to ageism. It also increases the likelihood of risky health behaviors like smoking and not taking prescribed medication. And it affects our quality of life and takes a heavy economic toll, both on us as individuals and on society as a whole. The effects of ageism on health are seen in all parts of the world and are most likely to impact disadvantaged groups. The great news is that we can do something to address ageism. As we show in the report, 3 strategies work in reducing ageism: policy and law, educational activities, and intergenerational interventions. Policy and law can address discrimination and inequality on the basis of age and protect our human rights. This strategy works in reducing ageism against any age group. When we talk about policy and law, to address ageism, it's important to consider that we're talking about both national laws and international law, which can include international conventions or treaties. And I think we will hear more about this from Cynthia after this presentation. Educational activities can enhance empathy, and they can also dispel misconceptions about aging and different age groups that we might have, and reduce prejudice by providing accurate information. They can be included in all types and levels of education and in formal and non-formal settings. And last but not least, we have intergenerational interventions, which bring together younger and older people to work on a task that is of common interest, be it gardening, sharing stories, living together. This strategy can help to reduce intergroup prejudice and stereotypes. Ageism is an issue that cuts across sectors and which requires commitment and action from a wide range of actors, including governments, UN agencies, civil society organizations, the private sector, academia, and many more. Fortunately, everyone can do something to advance these strategies. And just to conclude, ageism affects billions of people globally, and it contributes both and constitutes both a serious human rights problem and a far-reaching public health and development issue, as I explained in the last slides. Now that we know what works, we have no excuse to look the other way. Reducing ageism can prevent harm, it can reduce injustice, unlock human potential, and help create more cohesive societies. It is in our hands to create the world for all ages that we all want to live in. The global campaign to combat ageism aims to turn this vision into a reality, and we really hope that all of you join us in this movement to combat ageism. And the UN Decade of Healthy Aging, with its clear focus on addressing ageism, gives us a framework for action, with countries being really committed to putting an end to ageism. The time to act is now. And so I really urge everyone here today to help raise awareness about ageism, to challenge it when you see it, and to also support the 3 strategies in whichever way you can, so that we can help change the way we all think, feel, and act towards age and aging. There are a number of tools that we have created as part of the global campaign to combat ageism to support you in becoming a change maker. And we will be providing access to those links either through the chat or after the presentations. I thank you for your attention and look forward to any questions that may come up afterwards.
Thank you, Vanya. Just real quick, before we turn to Cynthia, I wanted to ask you about one thing. You said 1 in 2 people are ageist, which is a horrible statistic on the one hand, but on the other hand, it means that 1 in 2 are not. And I'm curious if in your research, you learned about any positive outliers, any countries or places where they do a particularly good job of avoiding ageism, avoiding age discrimination, and where we might learn some lessons about how we can reshape our own society.
Yeah. So what we do see is that ageism is prevalent across countries, but it is true that we see higher rates of ageism in low and lower middle income countries. But again, this doesn't mean that there is no ageism in other countries. We do see that it exists either in institutions, in our interactions with other people. So there's a lot of work to be done. We also have very good examples of different countries implementing some of the strategies that I mentioned. So for example, we have examples from Singapore, from China, from the US, from Iran, from Uruguay. So we have examples of good practices from different parts of the world. But unfortunately, the path to still cover is a long one. And I mean, just think that we've all been raised in an ageist society. Ageism is so present in our societies, and even what some would consider subtle forms of ageism, which we may see in humor, they're so acceptable today. People just laugh, which is not something that we would do if a similar joke were to be made on the basis of gender, for example. So again, there are promising examples and there's promising practice, but there's still a long way to go.
Okay, thank you. A lot more to get into there. But before we do, I want to turn it over to Cynthia Stewin, who's been doing terrific work with the United Nations and with the NGO community. So she can talk about some of the ways we can combat this at the kind of legal and policy level. Thanks, Cynthia.
Well, thank you. As you pointed out earlier, Peter, today is Human Rights Day. I think it's really fitting that we have this conclusion of the Ageism Week with Human Rights Day, because it was in 1948 that the Universal Declaration was adopted by the UN General Assembly. The Declaration, this is back in 1948, states that all human beings are entitled to all rights and freedoms set forth without regard to race, color, sex, language, political or other opinion, national or social origin, property, birth, or other status. Notice that age is not mentioned. I guess we older persons fall into the other category. Aging, actually, older persons were not really on the radar of the United Nations until the late 1970s. That's when the NGO committees on aging were formed here in New York, at the UN, in Geneva and Vienna. And I'm proud to say that it was a woman, Julia T. Alvarez, who was a critical voice that raised the awareness of aging issues at the United Nations. She was the ambassador, alternate representative of the Dominican Republic, and began her career there in the late 70s. The first World Assembly on Aging was held in Vienna in 1982, and the Vienna International Plan on Aging was adopted. The late Julia Alvarez was instrumental in establishing the UN principles for older persons and the establishment of the UN International Day of Older Persons, which we observe on October 1st of every year since 1990. She also got the UN to declare 1999 as the International Year of Older Persons. The Second World Assembly on Aging was held in Madrid in 2002, resulted in the adoption of the Madrid International Plan on Aging, or MIPA, as we refer to it. It's a good plan, but it has no teeth. They call it soft law because nothing is legally binding on the 193 member states of the United Nations that comprise the United Nations to enforce it. Well, in 2010, the UN General Assembly decided to establish an open-ended working group on aging, open to all member states for the purpose of strengthening the protection of human rights of older persons by considering existing international frameworks and identifying gaps. And in 2012, the Office of the High Commissioner on Human Rights identified that there were gaps, inadequacies that need and called for dedicated measures. Well, the open-ended working group has been meeting every year except one, and we're now coming up on the 12th session of the open-ended working group on aging next April, without really any progress. Well, violations of older persons' human rights have been witnessed before the pandemic, but COVID-19 brought those inequities front and center. We in the field of aging know that ageism is alive and well, and probably the most perverse ism, as this week of seminars has recognized. Over the past 20 months, we've seen the devastating and killing effects of ageism as we experience this global pandemic. Rationing of access to health care, access to treatments, access to vaccines based solely on age, as Vanya so eloquently pointed out. The death rates, just here in the US alone, 8 of 10 deaths are among this due to COVID are among the 65 and older. The World Health Organization reports 1 in 6 older persons experience some form of elder abuse during this pandemic period. We all have our horror stories in our own communities and globally that speak to the violations of human rights. For some who live in long-term care facilities, there have been some outrageous stories. This morning's New York Times covers stories on flagrant violations of older persons' human rights in some facilities. So why do we need a convention, which is a legally binding document, not a gathering of people? Remember, it's a legally binding document to protect the human rights of older persons? Well, here are just a few highlights, and then I shall turn to what you can do about it. A UN convention would combat ageism and protect human rights of older persons by providing a universal framework with the ethical, moral, and legal lens to scrutinize policies, programs, laws, and ensure surveillance. A convention would provide reporting and accountability to ensure the collection of data on older persons and help governments allocate resources more equitably. It would increase accountability and provide redress for violations of older persons' rights. Since current international law is clearly deficient in protecting older persons' rights, there is incontrovertible evidence that the UN conventions, such as those for women, children, and the latest, persons with disabilities, can be highly effective in positively changing the lives of those covered. UN conventions also serve to educate the public and empower people with the knowledge of how to protect, exercise, and enjoy their human rights as recognized rights holders. There are several places you can turn for resources. They are you could maybe show that first slide on resources for me. The Global Alliance for the Rights of Older People, a global alliance, as it says, has great resources that you can tap. It takes you step by step. It gives you background information. Also, Help Age International has wonderful guidelines called FAIR Guidelines, again, providing you with absolute step-by-step guidelines, tools, resources for how to introduce this whole topic and seek to have action at the local level, as well as our own NGO Committee on Aging in New York, which archives many of these resources. Honestly, I thought that the last open-ended working group that happened this past March, we would see tremendous progress on the global level, given the pandemic that had occurred. But in the words of the president of the Global Alliance for the Rights of Older People, what you permit, you promote. We permitted way too many violations for way too long to have occurred. I urge you to educate yourself, your friends, your neighbors, and constituents with these resources, and then next slide please, to stand up for rights of older persons. If you can't access the QR code, just shoot an email to the Stand Up for Rights of Older People, olderpersons@gmail.com. I'm pleased that ASA has signed on, and I hope that each and every one of you here today on this webinar will read the materials and do the same. It was the director of the New York office of the High Commissioner on Human Rights who said to me personally and recently in other webinars, when asked why a convention promoting the rights of older persons has not gotten any traction. He said, first thing he said, older people are too polite. The second thing was, you need to make more noise. And it was interesting that on Wednesday's webinar this week, Elizabeth White, one of the speakers, said exactly the same thing, that we all need to toughen up and make some more noise. So let's start making some noise, be less polite, and stand up and take action now. Thank you.
Thank you so much, Cynthia. That was really helpful. Now we're going to turn to Justin Derbyshire to talk a little bit about Help Age International's campaign to expose ageism and outline some of the work they've been doing with people from around the world to hear their voices on these topics so that we get broader representation of older persons from around the world and some of the work that they've been doing to look at the legal frameworks of certain countries around the world. So Justin, I'll turn it to you.
Well, thank you very much, Peter, and thank you very much to ASA and to AARP for inviting me along today, and to my colleagues on this issue, Vanya and Cynthia, for their words. I'm just going to try and really bring to light how HelpAge, with its network members around the world, is trying to really, at the ground level, action some of the recommendations that have been put forward from the WHO Global Report on Ageism, as well as then provide more evidence to support the push for a UN Convention on the Rights of Older People. Just for a number of you, if you could bring up the presentation for me. For a number of you may not be aware of HelpAge International, please do visit our website. But HelpAge is a global secretariat for a network of 164 members in 86 countries. If you go to the next slide for me. We work directly through 300 staff based across the globe to support activities in lower income and middle income countries to advance the quality of life for older people. We focus on doing this through improving well-being, through enhancing dignity, and for ensuring that older people's voice is heard at the community level, at the national level, the regional level, and at the global level. At HelpAge, we really strive to push forward the fact that everybody, everywhere, has the right to freedom, equality, and a life lived in dignity. We know through our network members, through the conversations we've had with older people in every region of the world, that as we grow older, we face stereotyping, we face prejudice, and we face discrimination because of our age. This stops us from enjoying our human rights equally with others. As Vanya mentioned, the COVID-19 pandemic has shone a light on how widespread and deeply rooted ageism is in our societies. We saw older people stereotyped as frail, vulnerable, unable to make decisions for themselves. And we saw in numerous countries age limits put on who could access healthcare and who could leave their homes. At HelpAge, we have started to focus on, as a pillar of our work and our new 2030 strategy, a world without ageism, where age discrimination is fully prohibited in law and unlimited in practice. Much of the work that's ongoing at the moment is against ageism, focuses on ageist stereotypes and prejudices in society, but we need to look at all areas, and especially the law at a national level. At HelpAge, we've rolled out training workshops to our network members and to staff in all the regions that we work. And the training has focused on identifying how ageism manifests itself in different contexts and to challenge people's own unconscious bias towards aging and older people. We've also developed ageism training materials, many of which can be found on our website. And I know that the ASA is going to show a pack with our presentations and with links to these afterwards. We've been supporting our partners on a number of countries to campaign specifically against ageism in their local contexts. For example, in the Philippines, during the beginning of the stages of pandemic, the Philippines government brought in an age-based lockdown. We supported our network member COSE to run a campaign to challenge the ageist message, to look at working with their National Human Rights Commission to engage the government, but also to develop and engage older people. They put together a system using Facebook to generate focus groups for older people. And within 4 weeks, they've got over 28,000 older people signed up on these. They were able to build awareness, develop up a radio campaign, grow support through that even further. And as a result, the law was overturned and a memo was sent to all provinces from the Philippines government, informing them that older people were not required to isolate at home. Now, if you could go to the next slide for me. We know that cultural beliefs and shapes and norms and values surrounding the aging process in older people to ageism can look different across different regions and contexts. And so we conducted a pilot qualitative research project to build an understanding of what ageism means to older people and how they experience it. And there's some comments and feedback from older people directly on the screen for you to reflect on. We took on focus groups in Costa Rica, in Serbia, in Pakistan, in the Gambia, in West Africa. And the themes through about the different settings were experienced, how older people experience ageism. And these included the family, public transport, through government policies, through educational institutions, through health services, in the financial services, in the media, in employment, and also in the laws that govern them. The examples that were provided were different, but there were clear themes that came throughout from each country. If you could go to the next slide. Vanya spoke about the WHO Global Report on Ageism, which has been a great output. It's really helping us across each of the countries we're engaging in. One of the findings of the global report, as you will have seen, is that on ageism is that the policies and laws can be used to reduce or limit or eliminate ageism. We know that anti-discrimination laws in many countries do not prohibit age discrimination. We know that there are different legal standards, means that people's experience of ageism and discrimination will therefore differ in different contexts. I'm delighted about the project that we've been able to develop with AARP support. This project addresses ageism and age discrimination within the law. It aligns with the strategies identified by the WHO to tackle ageism that Vanya spoke about, but it also looks at the recommendations and takes forward recommendations from the UN experts, independent experts report on ageism and age discrimination. The project has developed country studies to formulate overarching recommendations on what constitutes a legal framework at a national level that effectively addresses ageism and age discrimination. This project is crucially important. As I mentioned earlier, much of the work that's going on focuses on ageist stereotypes and prejudice. This project really looks at ageism and age discrimination within the law. If you can move to the last slide. What we're really pushing for then is we're looking to ensure that we develop the capacity of local civil society so that they can mobilize older people, engage and build awareness across communities, and then really push for governments to change their anti-discrimination legislation in line with the recommendations from the WHO's global report. And so far with this project, we've found that national legal frameworks on equality and non-discrimination contain a number of key gaps. They're weak, they're inconsistent, and that undermines the protections afforded to older people in practice. Whilst the contents of the rights that exist to equality and non-discrimination under international law have been clarified, there's insufficient practice relating to older people. And without an independent UN convention, states are unclear on their legal obligations, which leads to greater gaps in protection. So what we've already seen has proven what we've been aware of. The issues can only really be addressed by improving applications of existing frameworks to older people, and also through the adoption of a specific UN convention on the rights of older people. We really do need to work together to find solutions and continue to challenge ageism persistently. We also need to look at ourselves and challenge our own individual beliefs about aging. To conclude, aging stereotypes are all around us. If we all start to call them out and challenge them when we see them, then we'll help create a society for people of all ages. And critical to this is intergenerational activities that can help build understanding and can help change attitudes. Thank you very much.
Thank you so much, Justin. I wanted to just do a quick follow-up to ask you about a related project that you have, which is to develop something called an age equality duty. And it's almost as an affirmative duty or a positive duty with respect to older people. And I wondered if you could say just a word about that as well.
In terms of the work that we're doing with yourselves, Peter? Yeah, so I think for us at HelpAge, it's a critical piece of work that we need to develop further. And I think for us, we're looking to build on that over the coming years with the draft country studies, and to be able to show from those that to prove that there is the need for a legal framework and what that positive action will enable for older people. We need to carry out and show that there are incredible amount of the normative gaps that are there and the lack of available case law, and we need to build on that. There are some exceptions, and we're really working on proving where there is positive deviation, and to be able to showcase the actions there.
That's terrific. Before I ask some other questions, I wanted to check to see if there were any questions from the audience that we wanted to bring forward.
Not at this time. Let's get everyone on screen and start the discussion while we wait for more to come in.
One question I'll throw out there, and this may be a little unfair to Vanya, but I understand that some international organizations still have mandatory retirement ages. And I wondered if that's something that's the case at the WHO, and if you know of anything being done about that.
Yes, so this is unfortunately still applicable across UN agencies, as it is applicable across other employers or other sectors. I mean, at the end of the day, institutions are a reflection of our societies, and our societies are unfortunately still very ageist. So there is work to be done also internally within the UN system to make sure that we take on an age management approach that does not only consider retirement age, but also how we manage and foster a multi-generational workforce. So again, I think this is something that applies to the UN system, but it applies to many other employers around the world. And we are in conversations internally also to start making those changes and see how age can be considered along other grounds that are already being covered, so that again, we address ageism internally but also externally in the world. But thank you for the question, Peter.
You know, I think all of us are very focused on ageism and looking at the rights of older persons in particular. But as you know, individuals are not, monolithic. People are older or younger. They have genders. They have sexual orientations. They may or may not have different abilities. And I'm wondering if any of you are working on the intersectional nature of ageism and how, for instance, older women may have unique needs and harms in that space.
Yeah, I think, Peter, that's a really, really critical question. I know the NGO Committee on Aging in New York, we're working closely with our sister NGO committee on status of older women, as well as the intergenerational major group and other stakeholders, because it really is. I mean, and young people are discriminated against as well. So we share, we think of the ageism as really applying to older people, and it does, but it also affects younger people. And then you get into where the inequities begin, whether it be education, for all the other intersectionality, whether it's your gender or your gender identity or your race or whatever. And what we're talking about, though, is the lifelong, for older persons, it's a lifelong accumulation. And where we have to back it up to change it is now, but with the generations yet to be born, but who are coming down the pipeline. So I think it provides a great opportunity for us to work very closely, intergenerationally, and across all the sectors of which this ism affects.
Thanks, Cynthia. Justin, I see you have your hand up.
Yeah, I mean, just to build on both what Cynthia said, but also, just to say that, the Global Report on Ageism was really an important step forward for us, and it's given us an incredible kind of a roadmap forward. You point on the intersectional of gender and age is a huge one, and particularly in developing countries where predominantly the older women are living a lot longer than older men, and in patriarchal societies, when then the older women are then subjected to pressure, financial pressure from the family. They obviously, if they develop illnesses, there's an incredible amount of persecution, particularly in East Africa, on the issue of witches and particularly when an old woman develops mental illness. And so these areas, you can see, you've obviously got inequality across the life course, really being exacerbated in older age, pensions that do not provide support for women over certain ages. And so these steps really, and these actions really do make life further challenging for women of a certain age.
Vanya, I see your hands up.
Yeah, so I mean, if we look at intersectionality, the only two intersections that we have found to be more addressed in research are actually the intersection between ageism and sexism, and between ageism and ableism. And of course, as you were saying, we're not just a younger person or an older person, we're also then a compound of other characteristics that can be used to for us to be facing specific disadvantages. So it is important that other intersections are also explored as we move forward. But in terms of the intersection between ageism and sexism, there is a term that was coined years ago, which is gendered ageism, and which is used to illustrate the differences in ageism faced by men and women, where women tend to be in this situation of a double jeopardy because of both their age and their sex. And we do see, based on research, that older women tend to be most affected by this intersection. I would say that it is present across countries. So there are extreme cases that Justin was just describing now in terms of accusations of witchcraft, which tend to happen in some parts of the world, including sub-Saharan Africa. But in other parts of the world, this affects older women in employment, where, for example, you do not have the same opportunities for employment, and then you live a longer life. You don't have equal access to pensions because perhaps you took time off to care for children or for your partner. We also see it in healthcare, for example, where there are disparities in terms of older women's access to treatment or preventive care compared to older men. So again, this intersection is visible in different parts of the world, even if the specific manifestations may be different depending on the context.
Thank you for that. Actually, I'm pleased to announce that AARP is going to get much more deeply involved in that issue going forward. Our UN rep, Erica Dar, is going to be working on that issue with the UN starting in March. So we're really looking forward to hopefully making some progress on that issue. I understand we have a question on workforce and ageism.
Yes, not entirely unrelated to your comments, Vanya. The question is, one, do you believe that the issue of ageism and age discrimination should be part of diversity and equity and inclusion programs within companies? So we're talking about the private sector now. Should it be required to be part of that conversation? And two, could you touch on the work or the influence that the UN, WHO, HealthAge, or even AARP might be doing to work directly with companies?
I can jump in on that real quick and then turn to the others. last year, AARP conducted a global employer survey of 6,000 major employers from around the world. And of those, I think something like 87% said that it's important for them to be focused on supporting a multi-generational workforce. At the same time, only 47% of those same corporations had policies to look at age and inclusion in their diversity, equity, and inclusion policies. And so AARP has a big project called the Living, Learning, and Earning Longer initiative, which is really intended as a real friendly, open forum learning platform for global corporations to learn more about what they can do to support a multi-generational workforce. It's so critical, particularly in this age, as we're seeing, at least in this country, the need for more workers. As people live longer, healthier lives, they may need or want to work longer. And so the workplace needs to adjust to support older workers. One of the things that we are also going to be doing, we're just starting some of this work right now, but we'll do it into next year. You have the ESG kind of guidelines that lots of corporations are talking about. These are environmental, social, and governance standards that first came to place around sustainability and the environment. But the S for social deals with a lot of things like human rights, labor practices, and others. And so we're trying to work with some of the rating agencies right now to get them to incorporate looking at the diversity, equity, and inclusion policies of corporations so that age is included. Because as you know, if something's measured, then it matters. And so we want these companies to start to pay attention to kind of the stratification of their workforce along age so that we can be sure that all ages are included appropriately. So that's my answer from AARP. I'd open it up to the others as well.
Well, definitely, it's very important that age is included, because whether you're an older white male, an older black male, an older Filipino, whatever, it doesn't matter. You're all going to be subject to certain discrimination. But I think we have to understand that sometimes for older, I'll take the case of women particularly, when we've seen for women in general with the pandemic, they've lost ground in terms of pay equity, in terms of promotions, et cetera, because many with the pandemic had to drop out of the workforce. Now that's country by country related based on what your availability is for childcare or et cetera. But there's real inequities across. And then you get into the lower income level workers, and those resources are far less. And so it's this self-fulfilling. What is an opportunity for us is with the Sustainable Development Goals, with the Decade of Healthy Aging, what we've experienced with the pandemic, is to begin to change the whole paradigm of how we as become just societies, recognizing equity and overcoming the inequities. Because if you have poor prenatal care and then poor infant care, inadequate education, some countries which have stopped allowing women to go to work in some countries, you realize what kind of how incessant all of the inequities become over the life course, that make it really important to address as we have a global population of aging. And there's this real opportunity, but it's also a big challenge for us to really overcome and correct long-term inequities.
Vanya, is your hand still up from before, or did you want to jump in?
No, it was a new hand, but I'm also aware of the conscious of the time. But I mean, just quickly, I guess I would say that yes, diversity, equity, and inclusion policies should be mindful of age. I don't think this is included in many private companies at the moment, or companies in general. There is great training, for example, on unconscious bias that does not yet include age, and I think there are actions that need to take place. There are also positive efforts in that direction. For example, efforts by the Global Coalition on Aging that is trying to push forward guiding principles for the private sector. But as Peter was saying, one thing is having a guiding principle, another thing is actually putting it into practice and what that means. I think private companies are also realizing the potential of having a multi-generational workforce and actually creating flexible workspaces that allow older people to continue to remain in the workplace if they want to for longer. So again, I am hopeful that we will be seeing great changes in this area as well in the coming years.
Wow. Well, this conversation, maybe not surprisingly, went so much faster than I expected. We're already at an hour. I'm going to turn it back to Peter Caldas in a second, but I just wanted to first of all, thank all the participants, meaning everyone who's dialed into this. I know in some respects you are the willing, you're already engaged in this conversation enough to be with us here. And I really appreciate that and all the things you might do. And of course, to thank our fantastic panelists, our experts, and people who have been doing terrific work on these issues around the world and for a very long time. And for both Vanya and Justin, they're in Europe, and so it's very late for them on a Friday night. So thank you both. I'll turn it back to Peter now.
Thank you, Peter, and thank you to our guests. It's now happy hour dinner time for some of you, so thank you. I want to reiterate something that Cynthia sort of mentioned subtly, but I want everyone to know that the American Society on Aging has signed on to the campaign to have a UN Convention on the Rights of Older Persons. It is entirely consistent with our policy priorities to battle ageism, and we know from other conventions that these matter and they have impact. So we're right behind all of our partners on the campaign. I also wanted to thank everyone for joining us. And someone in the chat mentioned just how rich this conversation is and how we just don't have enough time to get to everything we want to talk about. Well, that's why we're going to continue these kinds of conversations at our annual conference in April called On Aging 2022. We hope you all join us in person in New Orleans. That's the week of April 11th. You can sign up to register at onaging.org. And we hope we see you there in person. And we hope we get to meet all of you and continue these really important conversations and these important learnings. Anyway, that wraps up our Generations Forum week. I want to thank all of you for attending. I also want to thank the ASA staff. You all did a terrific job putting on a fantastic program for all our ASA members and non-members alike. So thank you very much. We hope you have a wonderful weekend and a great holiday season. Bye-bye.
Thank you. Bye-bye.
Thanks, man.